And good morning and welcome to the September 6th, 2022 Cumberland County Board of Commissioners. Hope everyone had a tremendous Labor Day yesterday. Everything just started a little bit later after a holiday weekend. But we would welcome everybody here today and thank you all for coming so much. And with that, we'll do an invocation and the Pledge of Allegiance led by Commissioner Tony Stewart. Okay.
We can bow our heads. God, we thank you for this day that you've given us. We thank you, God, for your goodness, your mercy, your compassion, God, that you have bestowed upon us. God, I pray that you would give each of us wisdom so that we can carry out the duties that are assigned to us. We pray for each and every citizen here in Cumberland County. I pray, God, that we will do right by the people's business, God, and that we would be the individuals that you have called us to be. In Jesus' name. Our pledge of allegiance
to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Everybody having a good time. I'll call on the county manager. Are there any changes to the agenda?
No, sir.
I'll call for a motion to approve the agenda.
So moved.
Second.
It's been moved and second to approve the agenda. All those in favor?
Unanimous?
And that will take us to our presentations, and I will take us to the manager, Cumberland County monkeypox update.
Yes, sir. Good morning, Mr. Chairman and
Good morning.
Commissioners. I've asked Dr. Green to provide a short update on monkeypox in Cumberland County. Welcome, Dr. Green.
Good morning, Commissioners.
Good morning.
As the County Manager mentioned, we are going to provide just an informational update about monkeypox in general and then an update about our outreach efforts in Cumberland County. So a little bit of background first about monkeypox. This is, up until this year, has been a pretty rare infection, at least in the United States. Typically, monkeypox shows up in West and Central African countries. One question that we often get is it necessarily caused by monkeys? And not necessarily. It might show up in other types of rodents. This current outbreak that we're in is showing up in countries outside of these traditional areas. So in the UK and of course in the United States and other places around the world where we don't typically see cases of monkeypox. Our current outbreak...
Can I ask a question?
Yes.
Just before we get into it, and that's fine. But can you tell people what monkeypox is? I guess that's the very first thing is everybody has heard the word, but doesn't necessarily know what it is or what...
Absolutely, yes.
I looked through that. Okay.
So it's a pox virus, and so if we think about it, kind of falls in the same, it's an orthopox virus, so it falls in the same category of smallpox, but it's different than smallpox, but it falls in this same kind of category of viruses. So it is a virus, and it's caused by, it's communicable, so it causes from person to person is how it's spread. And then we'll get some, maybe I can answer a little bit more of that question in just a minute. So currently, our current outbreak began in May. Nearly all of our cases in the United States and across in Cumberland County and across the country have been in men who have sex with men, although that is changing. And it's important to note as we think about our response efforts that monkeypox can be acquired by anybody, regardless of your gender, your age, or your sexual orientation. And so we're making sure as we do our response efforts that we are making sure we're responding to those that are the highest risk, which are currently men who have sex with men, but that we are making sure that everybody is aware because as we've learned with COVID, that viruses quickly jump populations. And then monkeypox, of course, has been declared a national public health emergency and as well by the World Health Organization. So people often ask us how this compares to COVID-19. And so it's the same in that it is a reportable, communicable disease. So our labs and our healthcare providers are required to report that to the health department or at the local level or at the state health department. A key difference here is that monkeypox does not spread as easily, and so it's harder to transmit from person to person, and it does is rarely fatal. But the important thing to note is just because you can't die from monkeypox or that does not occur as often, it can cause hospitalization and very debilitating pain. Another key difference here is that we started ahead of the game. We have testing capacity in ways that we didn't have before. Notably, we don't have a rapid test, so there's not a drive-through 15-minute get your test result back. That's not how the test is set up now. We still do case investigations and contact tracing for our positive cases, just like we would with any other communicable disease. And we still do isolation and quarantine we do isolation of our positive cases. A difference here is that we do not quarantine our close contacts, but we do monitor them on a regular basis and we check in with them. And then again, the other way that we're already ahead of the game in our response is that we already have a vaccine that is safe and effective, although currently it's in a limited supply. So if we look at our cases in North Carolina, this is as of Thursday, so it probably is a little bit outdated, but more than 300 cases in North Carolina. Again, most of them are 99% of them are among men who have sex with men, and we have 2 cases in the state that are among women. Again, anybody can get monkeypox. The majority of our cases are among young people. More than half are among 30 to 49-year-olds. Another third or so are among 18 to 29-year-olds. And then the majority of our cases are among African-American men. And that's important because our vaccine efforts, we're seeing that flipped where the majority of our vaccines are not going to African-American men. So you're going to hear about that in our outreach efforts. And then 87% are among those that are non-Hispanic. So in Cumberland County, we have 10 cases, and so we had our first case a few weeks ago, and then that's been increasing. The good news, I think, for monkeypox here in North Carolina and then around the country is that the rate of increase is actually slowing down, so that's good news. And that's thanks to vaccines and people getting tested. We have a very small case count, so we don't provide lots of additional information about the demographics because when we have that number of cases, small number of cases, it can quickly become identifiable. So a quick, and this might get to your question a little bit about Commissioner Adams about how we get monkeypox. What is it? It's through direct close contact. So unlike COVID, where people were very concerned about just being in the same space as somebody else, it requires very close, direct, intimate contact, and you have to have that direct, intimate contact with somebody that has monkeypox. Somebody that has the scabs or the rash or the body fluid, and we'll talk about that in a minute. Or it can be prolonged, and what we mean by prolonged, typically the CDC will say if you are within close contact 6 feet for 3 hours or more, is what we consider that prolonged contact, or during face-to-face, intimate sexual contact, which could include sex or kissing. Less likely, but also possible, is through touching items. So we share, and this might perhaps be in a household, or again, that intimate relationship that you share bed linens or you share clothes. And then also we know that pregnant people can also spread the virus. So we'll get in a minute about kind of what does it look like, but what it is similar to smallpox. It can cause these clear or pus-filled bumps. You might often start with a fever, so it might look like the flu at first, or even COVID, frankly. It could look like a fever, chills, a headache, and then the rash is going to come later. And then people often feel tired, or they have muscle aches, or their lymph nodes are swollen. So again, those flu-like symptoms that come up first, and then that's going to go into a rash later. So this is a few pictures of what it looks like, and I'll give the disclaimer that just like we do when we talk about STDs, just because your rash doesn't look like this doesn't mean that you shouldn't go get checked. It can appear differently. It can appear on the face, on the hands, anywhere the virus is. It doesn't just have to be limited to your face and your hands. So there are lots of different ways in which we can prevent monkeypox. The number one way is for vaccination, and we'll talk about that in just a minute in our vaccination efforts. Aside from vaccination, the other way is to avoid that close, intimate contact, that skin-to-skin contact with people that have monkeypox. So if you or that looks like monkeypox. So if you have a partner or a family member or a household contact that has a rash, then we want people to avoid that close contact with them. So typically we'll say wrap it up and cover it so that people can avoid that close contact. Also, if in the scenarios in which it's sexually transmitted, condoms can help protect from exposure, although that is not sort of the panacea. Condoms may not protect and prevent all exposure. Also, one of our strategies is to help people understand limiting the number of sexual partners. And then the other primary place where we see monkeypox being transmitted is where people are in very close quarters, like at a club or a rave or at a bar. And that's where people are typically, or where we see much more likely to spread because you're having that intimate, close contact in those areas that are very tight and enclosed. So what we're recommending for the public is that if you have a rash that's consistent with monkeypox, even if you don't think it's that, then you can call us for testing, and you can if you have symptoms, or you have a new or unexplained rash, call us and we will help you get tested. Or if you have been in close contact to somebody that's been diagnosed with monkeypox, you can also call us for testing. And we do that by appointment at the health department so we can make sure that it's a confidential visit. And then again, just like I mentioned, we still do case investigation and contact tracing. So this looks a little bit different than COVID. For all of our positive cases, there's not a set time for isolation. So it's different than COVID, and it's not 5 days of isolation and then you're done. It really depends on the rash. So you are done with isolation when the rash is fully gone away, the scabs have fallen off, and the skin has healed over, and then we can end your isolation. So it's different for each person. And then we work with that individual to identify their close contacts. We monitor their close contacts for symptoms, and we do that for 21 days. However, there's no quarantine requirement for those close contacts. We recommend that the close contacts get vaccinated. And unlike COVID, if you've been exposed, if you get vaccinated within the first 4 days, you're much less likely to get monkeypox. So there's some after exposure protection. And then if you get vaccinated within the first 14 days, you may get monkeypox still, but you're much less likely to have that severe illness. And then we monitor those folks for symptoms as well. And then again, remember that the transmission of monkeypox, this is important for the public to know, requires that really prolonged close contact. So the CDC has kind of put some examples of this together. This is not all inclusive. But again, your highest risk of exposure is when you have bare skin-to-skin contact with somebody that has tested positive for monkeypox. Again, that might be through sex or kissing or cuddling or hugging. You will have some exposure if you are in a place like a bar or a club or a rave where people aren't maybe wearing as much clothing, or if you're sharing utensils or cigarettes or hookah or vape pens or pipes. Things that where your mouth is touching something else that somebody else has touched. And then again, that exposure to those respiratory droplets, again, where you don't have a mask on, and it might be that 3-hour, that time frame. You're much less likely to be exposed if you are just in the grocery store or shopping at the mall or just hanging out with somebody, or you're just shaking hands. So this is different than COVID in terms of what we consider to be exposed. So we do have vaccine available at the health department. We have a approved vaccine already that's under an emergency use authorization for some age groups. and it's called the Jynneos vaccine. And it's a 2-dose series, so you come to us, you get a vaccine, you come back 4 weeks later and get a second. This is for adults 18 and over, and then we do have vaccine available for our kids that are under the age of 18, but they do need parental consent, and that is under an emergency use authorization. And then, of course, at the health department, we offer those vaccines for free, regardless of your insurance status. There are some eligibility criteria for vaccines because it's in limited supply. We don't have enough vaccines for everybody. And so effective tomorrow, the state is going to announce later today some expanded criteria. And the criteria is of most, again, for those that are the most high risk right now. And that's anybody who's been in contact with somebody that's had monkeypox in the last 14 days. Again, and then we're going to focus on the population that's most at risk. So that's going to include gay, bisexual, and other men who have sex with men, or if you identify as transgender and you're sexually active, or in that same age group, or people who have had sex with gay, bisexual, or other men who have sex with men in the last 90 days, or people who are on the drug PrEP in the last 90 days, or who have had syphilis in the last 90 days, then you are also eligible for the vaccine. And so for those that are eligible, then they can come to the health department and we can get them vaccinated as well. And then a couple of things about our outreach updates. We've developed a website for this. We've done a couple of informational webinars for the public. We've done some specific updates for our schools, our college and universities we've been in contact with. The state also held a webinar for our detention center and our those that live in congregate settings. Those that we've also reached out to some of our homeless serving agencies and our PrEP providers to make sure that they are aware. Our PrEP providers are those that also, many of their clients and customers are also going to be eligible for the vaccine. And then we've also pushed out information to our local providers. We do radio and TV interviews, and then we've done some paid social media, specifically making sure that we're targeting the population that's most at risk. And then we've developed these kind of postcards, and we've gone to bars and clubs and different outreach events, and we'll drop those postcards so that people that attend those areas that are high risk will also have those available to them so that the public can have those in the community. And that's all I have for you. Are there questions?
Anyone have any questions, comments? Commissioner Evans.
Thank you, Mr. Chairman. Quick question. I've always had concern about the way we distribute information here as getting out to the general public regarding any issue that we have that's important to our citizens. Radio and television interviews, fantastic. Is there anything else that you're doing with the radio and television that is getting information out? Okay, what I'm at, okay, what?
No, good. I'm
No.
I'm nodding and listening.
No, you go ahead and answer. Go ahead and answer before I go ahead, because you were shaking your head yes, as if there was something else that you wanted to add.
So our state, they have a media campaign, and they also are pushing out TV ads as well so that people are aware. And so those are going out statewide. So we didn't want to duplicate their effort there because their TV ads are going out statewide. So, but we don't specifically have radio or TV ads about monkeypox, but we've done, but we're getting that target group from social media.
Okay. I mean, that's okay. That's okay, and I understand that, but I just think that we as a community within ourselves, we have over 300-some thousand residents here that need to know that the Cumberland County Health Department and the Cumberland County Board of Commissioners are taking steps to inform our citizens adequately about what's going on in our community and what we're doing, not what the state is doing.
Right.
But what we're doing as a body to make sure that our citizens are taken care of and have the resources needed to be taken care of. And I just don't think we do that well.
Okay, we can certainly.
And I'm not talking about one specific
Sure.
place. I'm talking about overall. We just have to do better at that.
And
Oh, here come the PIO man.
Sorry, I want to add to that comment. We do have some agreements with some of our local radio providers, the Beasley Media Group specifically, and we're working on PSAs for that medium. We are trying to build more into that, just as you mentioned, trying to figure out how we communicate with people, how people receive information. So that is actually happening in this case as well, but it hasn't been pushed out yet.
Well, that's great, because the attention span is like that. And I think that there's things that people need to hear over and over and over again for a period of time for it to sink in, the importance of it and what we're doing. Thank you so much for that information.
Thank you. And so what we'll follow up on that one and make sure that we are pushing those out as well. And then we know that, as you said, people need to see it again, so they need to see it on the radio, they need to see it on the TV, they need to see it on their phone when they scroll, to make sure that they're getting it in multiple different ways.
Mm-hmm.
Commissioner Evans, I would tell you, every Thursday morning, I think you can hear Dr. Green on WFNC, and just about every other day on We Do, I think I hear.
Monday, Wednesday,
every
Friday.
morning. I wonder, and I'm not just, I'm just saying, she's,
Yeah.
and I think with our website and all the things that we have, unfortunately, we don't have a TV station here in Cumberland County, and so it is important to be able to get that message out. I agree with you 100%. I think everybody does.
Well,
so.
and I understand it. I appreciate all the effort that she's doing. I'm not being critical.
No, but I
I'm
understand.
I'm just saying
Yeah.
that we have WFSC and we have WIDU, but we also have W this and W that
But that's
and
what the
W
media,
this.
that's all the media.
Okay.
Beasley, they own every other radio station in town.
No, they don't.
Beasley does. You know, if, and we just finished talking about monkeypox, but let me just take you to one other thing. School just started, and I think it's important that we emphasize vaccines for our kids to going back to school. It is crucial that in New York, the polio vaccine, which we thought was eradicated, because we do have some folk who don't believe that vaccines, and that's their choice. I'm not making anybody, but I think it's important, and that the health department does provide those vaccines. So if you could just speak to not just this monkeypox, but vaccines in general, just so that our citizens know that they have the opportunity to be able to do that. Thank you.
Yes, we have a lot of things going on this week. So
Right.
we have our back-to-school immunizations. We still do that at the health department every day. And then this year, we've partnered with the school district to do some vaccine outreach clinics on campus. So our first one is tonight. That is at Mac Williams. And then we have one other one on Thursday at Lewis Chapel. And then we have another one a few weeks from now. And then we also will have our late-night clinics. We had our first one, we do that on a monthly basis. So we had one in August that targets our back-to-school immunizations, and then we'll do another one. What day is this? We'll do another one next week. And then our 7th graders and our 12th graders who are ready for back-to-school immunizations, those are the key groups that we're targeting right now. Those will be available at our outreach clinics. We'll have a $10 gift card for everybody that comes to get their vaccine. We'll have COVID vaccines there as well. And then we will have our kindergartners can come to the health department. Our kindergartners need a long list of vaccines, so it's trickier to get that off campus, but they can come to the health department. And then our school district has been fantastic. They've been pushed that out via the class dojo, and then I get a call every Sunday with the information for our back-to-school immunization clinics, and then we've got flyers, and we've done some paid media as well for the back-to-school immunization. So the important thing for our kids is that 30 days after the start of the school year, so that's the 29th of this month, those kids get excluded from school if they're not up to date on our vaccines. So we need our parents to come get all their kindergartners, 7th and 12th graders up to date on their vaccines. So we're excited to partner with the school district this year on that.
Thank you. I think it's important that we make sure that that's information on everybody's website, send it to the city. The school system has been a good partner in this relationship, and I just think vaccines, we need to make sure they have that, so that, again, we talk about the polio vaccine in New York that we thought was eradicated coming back. So encouraging everyone to, and I think there's many opportunities to be able to get your vaccine and vaccines without cost. So we encourage everybody to to take advantage of that. Thank you, Dr. Green. Anybody else have any questions or comments pursuant to that besides Commissioner Evans? All right. Thank you, Dr. Green.
Thank you.
That will take us to the consent agenda. Are there any items to be removed from the consent agenda? I would ask just for a moment that we pull item S. I was asking for some information on item S so we can go back to that. With that, if I can get a motion to approve the consent agenda absent S.
So move.
Is there a second? It's been moved and seconded as to the consent agenda. All those in favor?
Unanimous?
Madam Manager,
Yes.
I just asked, that's a 12.44 acre, and I was just, we were doing some other things. And my question is, where was it located? Because in the description down there, it doesn't give me a description of where it is.
Yes, sir. So Mr. Jackson has
Ma'am.
found it on GIS, and it's at the end of Deep Creek Road, right on the river,
Okay.
which is off Sapona Road.
I know exactly where that is. Okay. It-
If I'm not mistaken, it's landlocked, I believe.
It is.
Yes. Yeah, this is the same one that was owned and pulled off and
I
bought back.
understand. All right. I don't have any other comments. If anybody want to make a motion to approve? Motion to approve. Been moved in second. All those in favor?
Unanimous?
All right. Thank you. That will take us to an item of business, consideration of the Crown Center, Madam Manager.
Yes, sir. Thank you, Mr. Chairman. On August 16th, the Crown Event Center Committee met and approved several items. There was discussion about an RFQ for architectural services. As you know, that we're trying to keep this project on track on the timeline with the closure of the Crown Theater. And an important part of that is the architectural services agreement, as well as the guiding principles that become the foundation for the design of that facility. And so this morning, we want to share that with the full board for consideration. Our project manager from MVP, Matthew DeSilva, is here this morning to share those guiding principles as well as the RFQ. Good morning, Matthew.
Good morning.
Good morning, and thank you, Commissioners, for having me. Just use sidebar. All right. So an agenda for this morning is just to walk through the community engagement, how we came to the guiding principles for the project, looking for different actions from the board, and then what the next steps will be. So for the guiding principles workshop, we had a community engagement committee, which was made of many leaders in the general community, and then end users that will be a part of the project in the end. There were 44 individuals and organizations that were invited to be represented. 13 of those members attended, and 5 additional members had spoken with us separately offline because they were not able to attend the workshops. And then we had 8 community engagement members that also attended the final wrap-up, where we took the information. So we had to have multiple workshops to give different opportunities of time for people to be involved. And then we had a wrap-up afterwards that we could bring together all the thoughts that came to it to come to the final guiding principles. And here's just a list of who were a part of the workshops that we had. So was not going to go through the listing. I just wanted to have that up on the screen just in case there were any questions from this listing of individuals. All right. So we did receive a lot of feedback from the different groups that were involved. They were very happy to be able to put their input in, to be able to bring their thoughts, their understanding, what they want to see and what they think this community, this center should be for the community. Going into what the guiding principles are, we are going to be using these as the cornerstone of what we will be designing to and building for the facility, for what the community wants, what they want to be involved, and how their money should be spent on the project. So it really is a definition. We will bring this up at the very beginning. It's part of the RFQ process. It will be part of an info session that we bring forward. We'll be looking back at this again while we're doing the master planning and while we're doing the design to really take a look at, are we bringing in the values that are brought forward from the community? So, and these are the final guiding principles that we did end up with. Again, I believe you may have had these previously, but it really does look towards bringing in a venue that is not just a local venue, but a venue that can bring in regional acts, it can bring in nationwide acts, it can be something that can be really a proud area for the community. It can be used local, but be able to have a way to bring in revenue, bring in economic development for the full community. They're really looking at this to be able to help with growth and keep moving things forward in Fayetteville. So I think it's a great what they came up with. They wanted also to be something that all patrons that come to the community, that come to this center, can be proud of. And when they said all patrons, it was not just the people coming to attend an event. It was also the people coming to work at the different events. It was the acts that are coming in. They want to have something that people want to come to, whether they are an act, whether they are people coming to enjoy the facility or they're working at the facility. So that was very important to the group. And then they also want something that can be self-sustaining. The understanding that, you know, you do have to put money into it and have to have certain things in it to make it self-sustaining, but that is a goal that they want to work towards. So these are the items that came from the community engagement. I don't know if there's any questions on any of these.
All right, anyone have any questions or comments? All right, thank you so very much for that. Keep moving.
Yeah.
Oh, I'm telling them keep moving. I saw that part.
So the next part we go into is what we're doing towards the site selection process. So far, we have hired Timmons to help us out with the process and take a look at different areas in the county and in the Fayetteville general area to understand where this should be. We've gotten it down to having an analysis on all the different general areas that will need to be voted on eventually in order to go down to 2 areas, hopefully to move forward on. And we'll get into that process later. So next would be an info session that we would like to have on this Thursday. We've already put this out. Yes.
I thought we did 3. I thought we changed it from 2 to 3 at the end on the site selection. It went from 2 to 3.
Yes, that's correct. There's a discussion about 3 sites.
Right.
As we originally, in the proposal by MVP, was to
Right.
get it down to 2 sites, and there'll be discussion about that
Right.
later today.
Yeah, but I just wanted to make
Yeah.
sure that for us, it wasn't about 2, it was about 3, but go ahead.
Yes, you are correct.
Yes.
Thank you.
We are looking to have an info session. What we really are trying to do is get the local community involved, get the local engineers, architects, contractors involved with the nationwide groups. We want something that a firm has designed and built something similar to this somewhere else, but we want the local community to be a part of it. So we don't just want a nationwide firm coming in and have no local participation. So what we've set up is a info session to bring the different groups together. We're going to be sharing phone numbers, email addresses, and what the different groups do, what parts of the design they're a part of, what parts of the construction they're a part of. So these groups can start working together to build a team in order to present on the RFQ. So it is our way of trying to get that local engagement that we believe through the guiding principles and through discussions with county management that is really wanted for this project. And then the project schedule, as you can see here, we're really looking for the site selection to be a mid-November timeframe with after the further analysis. We are looking to start with the RFQ for the architect. We'd like to put that out on Monday, September 12th, in order to start that process. That will be a process that will take a while because we'll have to put it out. Architects will have to have time to respond. We'll need to review, grade the process, shortlist the architects, and be able to make a final decision. So that process does take a while, but we're looking for that to begin with the architect being hired before the end of the year. And then design and construction moving forward from them in order to meet a starting of events November of 2025. As the old center will be closing then, we don't just need the center to be construction completed then, but actually ready to hold events by then. And that's a tight window, but it's something that is, we believe is doable, and we're going to keep pushing towards. So what we are looking to do right now is have a vote on the guiding principles. In order to approve those, the Crown Events Center Committee had approved for them to move forward to the full board for consideration. We also have the architect RFQ, which was presented to everybody last week, and we're hoping that we can have any discussion on that and a possible vote to move forward on that.
All right, thank you. Are there any questions or comments? Then I would entertain a motion to approve the guiding principles that we saw and to move forward with the architect RFQ and proceed with the solicitation.
I move with that this board approve
The guiding principles and the RFQ
the guiding principles
and the RFQ.
and the RFP.
I second that.
It's a Q, though, not the P, the Q. 'Cause it's a
Correct.
difference.
With-
It's a
and
Q, yeah,
And the
request for
difference
qualification,
is
yes.
that if you're looking for a proposal, you're looking for pricing and everything to
Right.
go along with it. We're looking for qualifications
Right.
to just get the best qualified firm
Right.
and then negotiate a price afterwards.
Right. Thank you. So it's been moved and second for the guiding principles and the RFQ. All of those in favor?
Unanimous?
All right, thank you. Thank you so very much.
Thank
We'll
you.
keep this moving and keep it on track. Thank the commissioners and the committee for all their work that they do on that. That will take us to our nominations, and I will go to Vice Chairwoman Stewart for Board of Adjustments.
The Board of Adjustments recommends Kathy Dickens as an alternative member and Marva Lucas Moore as a regular member.
All right. That takes us to Federal Technical Community College for nominations.
Fayetteville Technical Community College Board of Trustee has one vacancy, and they recommend David Wilford for reappointment.
All right, that will take us to a motion to go into closed session.
So moved.
Is there a second?
Second.
All right. Well, I tell you what, they told me to do this a little bit differently. So, because we have to do all the property. So I'm gonna recess the Board of Commissioners meeting. We'll go up to 564, and we'll do we'll go into closed session in 564. So we'll be up in 564 for open session before we even close session. If anybody wants to join us up there, 564. No, we're gonna stay upstairs. We're gonna finish up upstairs. open session, coming out of closed session. If I can get a motion to adjourn? So moved. Second. It's been moved, everybody moved it, huh? It's been moved and second. All those in favor? All right, we are adjourned. Thank